As the debate on health care reform proceeds, I continue to stand ready to work on this critical issue. This is likely to be the most important legislation that we will ever work on as members of the Senate, no matter how many terms we serve. How well we handle this crucial issue will have an impact not just today, but for many tomorrows and countless years to come. If we fail to provide the change that's needed, it may be a long time before the Senate will ever try to do this again. I'm convinced that we have a perfect storm before us as we face this issue. The time is right, the political winds are with us, and we have the support and encouragement of the current administration and the people of the nation to get something done. That's why a good bill and a bipartisan effort are well within our grasp. If we're to do the work that's before us and do it well, however, we can't have one side or the other try to grab the reins and lead the effort exclusively in their direction. The American people are looking for us to solve the problem, and they want to know that we wrote this bill together, amended it together, and most importantly, finished it together. They know that no one side has all the answers, so they do expect us to put partisanship aside. This is too important an issue not to follow a path that will produce a bill that will have the support of 75 or 80 members of the Senate. I have every belief that we can do that. Let me be very clear about what I believe we can do if we put partisanship aside and work together. We can draft a good bipartisan bill, one that will draw a large majority to its side, and we can get it done this year. With respect to the notion that we will be fostering competition with the creation of a government-run health plan, I think the public's growing tired of the government intervention in our day-to-day lives. First, there was our involvement in the mortgage system, then in our banking system. Then we got more involved in our nation's automotive industry. It's certainly more than a possibility that the government has taken on more than it can handle. We're certainly operating at more than the maximum capacity already. Having government take over our nation's health care system may be the last straw. Think about that. Think about all the things that just this year the government has decided to take over. And the comments I get at home and in other places I've traveled across the United States is, doesn't the government have a little bit of trouble running government? There's certainly a role for government as a strong regulator of free market enterprise, but the inclusion of the government as a principal player in these competitive markets is entirely inconsistent with our nation's capitalistic economic system. I'll forcefully oppose the creation of a government-run health plan. And in the big cities and towns of Chicago, New York, Boston, Los Angeles, it seems to me that there's a hospital or doctor's office on almost every corner. In states like Wyoming, however, they're few and far between, which makes health care a very precious commodity. So if we aren't careful with this legislation, we won't make health care more plentiful and abundant. It will make it even more rare and difficult to obtain. And when health care gets more expensive and less available in places like the big cities of this nation, imagine what it'll be like in the small towns of Wyoming and the West. People back home know what it will be like. Another one-size-fits-all policy that didn't fit so well in the rural areas of this country to begin with. And that's why so many people are really worried right now. The only way we can assure them that they don't have to worry is if we take the time to make sure that we get it right the first time.